they told us that Sarah Hurley can't appear because her diary was full for 6 months and beyond. A bit like dentists, perhaps. But we are delighted to be joined by Henrik Overgaard-Nielsen from the British Dental Association, and from Westminster by the Dewsbury MP, Paula Sherriff. Paula Sherriff, last night we highlighted your constituency and found that well over 60% of your constituents have no access to an NHS dentist. How are your teeth?
My teeth are okay, thank you, although interestingly I can also not find an NHS dentist in my constituency, but it's something my constituents are telling me about all the time. In fact, a man came to see me who resorted to pulling out his own tooth with a pair of pliers and a bottle of brandy because he was unable to access dental care.
Well, indeed, we showed that last night. Now, I'm wondering, well, what's your reaction to the 2 nights of reports that we've had? One in which reveals the acute shortage of NHS dentists, particularly in an area like Dewsbury, and of course the fact that there are children having their entire palate of teeth removed.
I think there are 2 issues here. I think Paula Sherriff and her constituents have been let down by the successive governments, actually, in not commissioning enough NHS dentistry there. Dewsbury will need, as far as I'm aware, another couple of dentists full-time to sort out the problem. And that problem is definitely to do with the 2006 contract, the contract we're working under now, because the problem is that the dentist in Dewsbury, the gentleman, the dentist yesterday said he had a surgery available and a dentist that could go in and do the treatment, but the local NHS are not commissioning him to do it. They're not allowing him to actually do the treatment that is needed in Dewsbury. And that's definitely a problem with the existing contract.
Isn't there another truth that dentists are more interested in the money, and there's a lot of money in private dentistry?
No, this dentist yesterday said clearly that he was anxious to get the dentist into the surgery and do NHS treatment. It's not a question of doing private treatment, it's a question of doing NHS treatment, but he's not allowed to because the contract says that he's only allowed to do a certain amount of NHS.
Well, clearly, Paula Sherriff, you have a situation in your constituency. We've actually even got an NHS dentist, and there may be more than one, but we spoke to the one, who has spare capacity but can't operate on any more people because they have not commissioned him to do that. That's a nonsense. What are you going to do to change it?
Well, I'm actually working as we speak with the government, and last week I met with NHS England and they have a plan. In fact, a decision was going to be made on that yesterday about whether extra capacity could be commissioned within my constituency to provide some extra help for new NHS patients. Clearly we have to look at the dental contracts. I think there's a couple of issues. We have to look at the ratio of private to NHS patients, but there's also another big issue for me. I understand that a lot of people are being brought back on a 6-month basis for a checkup, when that isn't always necessary. I've spoken to a number of dentists who suggest that if you have a healthy mouth of teeth, you only really need to see your dentist every couple of years.
But in truth, poor old dentistry has been a poor relation, a political football for years. Labour did nothing about this. Indeed, a lot of this trouble occurred under Andy Burnham. And what is the problem here? Why doesn't anybody want the mass of these people in this country to have access to an NHS dentist? Labour didn't produce it. Tories don't want it either.
I think it's absolutely unfair to suggest that Labour did nothing about this. I always had an NHS dentist under a Labour government. But we are where we are now, and I'm fighting extremely hard for my constituents. Everybody has a right to have NHS treatment, an NHS dentist. You know, we're in 2016. It's absolutely ridiculous. And in my constituency, in terms of the children, we have over double the national average in terms of children needing full mouth clearances. That isn't good enough.
OK. Well, let me tackle you with this one. I mean, I was told that, although my teeth might be rotten, the next generation, and indeed the generation after, is going to be fine because we're going to have fluoridisation. What's happened to Dewsbury, for example? Would that have fluoridisation?
I don't believe Dewsbury has got fluoridated water at all, but I think the other problem, and that's another problem we have with the existing contract, and what we need to change in the new contract, is that we need now a contract that is squarely based and focused on prevention.
There seems to be complete chaos in the relationship between doctors, dentists and the health department when it comes to contracts. Why can't this be sorted out? We're paying an enormous amount of money for a national health service and it ain't delivering.
Well, at the moment, the contract we've got is all about tick boxes and targets. So dentists are chasing around to do enough fillings to fulfill their targets. And that's ridiculous. What dentists need is actually, they need to do the fillings, of course, but they need to have enough time to sit down with their patients and make sure that the prevention and the oral health is improved for the patients. And actually, what we need, prevention has been a buzzword for several governments. What we need now is a strategy and a contract that actually squarely focuses on prevention.
Well, thank you very much indeed, Henrik Overgaard-Nielsen, and indeed, thank you very much, Paula Sherriff in the West.